Thank you so much, Michael. And now we're going to have the roundtable discussion. We've already had quite a lot of things come in the chat. The first one to you, Teymur, is about measuring negative, both political and social messaging from governments and other NGOs around PrEP. Because, you know, we like to hear all the positive messages from governments and NGOs around Europe saying, yeah, come on, where's the PrEP? Let's have it. What about the negative side of that?
Yeah, that's a great question. We monitor so many things at the ECDC, so it's difficult to measure absolutely everything. So we actually don't ask questions around moral and political.
What, you don't measure everything? Come on.
but I think we can deduce lots of things here, and I think, you know, we do monitor stigma. We've seen this EMIS survey that I talked about before that's measured stigma. We've seen maps on stigma. When you superimpose the PrEP map on a stigma map on Europe, it's going to be very similar. So countries in the western parts of the European region where PrEP is implemented, you're going to have less stigma. And the further east you go, the more stigma there are towards key populations and all kinds of services towards those key populations, not only PrEP, but when it comes to opioid substitution therapy or needle exchange programs, they're not made available to key populations. And this is very much politically and I would say morally driven as well. We don't have clear measures around how to capture this, but I think there's a clear association between stigma, moral and political conservative values, and availability of key services for key populations. So I think that's a fair comment to make.
And conservative governments, Michael, do you see that people come to Barcelona from other countries to escape partly the stigma, but also to access things like PrEP? They come to Checkpoint and talk to you about that?
Well, I don't think they come particularly to Barcelona. A lot of European people come to Barcelona because they like Barcelona and they live there and work there for a while, and probably have sex there. So, and then PrEP is a logical option probably. Now, if it's within the formal program of PrEP, people need a national health card. So that will be still a problem. So if you're just staying for a couple of months in Barcelona, you won't have a right to access PrEP. But then again, if people bring PrEP from their home or buy it online, then we will be very happy to give them control and check them for any STIs.
Yeah, and there is a note on the chat about people who are HIV positive not want to either visit clinics or be visited or have things delivered that might be recognized. They may, I mean, we've had this where people have said the drugs have arrived in a parcel, somebody else has picked them up, and they've sort of had disclosure that way. Well, do you think that that's a fair point, or do you think most people are more relaxed about this sort of issue?
I think that at the beginning there was a lot to do about stigma, and that probably was quite real. But I think things have changed. I think the community has seen that PrEP really made a difference in HIV infections, and made a difference in the way of having sex. Because don't forget that a lot of people have been born after HIV was detected. So they know HIV for their whole life, their whole sex life. And that means that you can't have really enjoy sex without thinking the whole time about the fear about acquiring HIV. So I think it's an important point that people see that they really have some advantages, and people talk to each other, and so people will say, "Oh, well, I'm doing this," and so and okay, maybe that's an option for me. On the other side, when we started the Checkpoint, it was clearly that we didn't want a clinical site. So it's a non-clinical site. It's a nice place to come. It's very transparent, so we don't do things in a hiding way, so you can see what's happening inside. and people are used since 2006, so that's already 14 years. They know us. We are attending around 8,000 men a year, so we are very well known in the community, and that means that that has relaxed a lot the thing about stigma, and the same is happening for PrEP, and we can see it now with what I told about the waiting list. I mean, we are getting 8, 9 emails a day, people asking how to access PrEP. So I think it's a good way forward.
So Teymur, your data about how people receive PrEP, I mean, less than half were in the formal sector sort of thing that when you did the survey. I mean, one thing you could say is, why don't you just make the whole sector informal so you can get it in pharmacies? And with the when you get the PrEP, you get an HIV test that they're saying, you know, a rapid test you could do yourself. And if you don't use if you use TAF rather than TDF, then the renal and bone effects are less, although in young people are not so much. I mean, why isn't there a move? Can you? I don't know what you think about that. A move to actually making it very informal.
Well, I think that's a question to you, Anton. Clinically, I think from my perspective, and I'm not a clinician, I think this follow-up has been critical, maybe so far, but with the new medications, maybe that becomes less relevant. But I do think, you know, we need to be testing for STIs regularly, and that we cannot do that needs to be followed up somehow. Whether or not the renal functions, etc., need to be monitored regularly, I can't say based on the new medications, but I think it's a valid question.
Yeah, I just think, Michael, what do you think that as long as you're having an HIV test and maybe you're linked to an STD clinic, or at least you can, that is I suppose that's a stumbling block. What do you think?
Well, I think we should separate like the first year when somebody starts on PrEP, at least with the medication we have now, and so it's pretty good to do a following up at the beginning. But after the first year, and that's the changes we are going to implement, I think we should relax. For somebody who is living with HIV, our controls are maximum two times a year. So why should we go 4 times a year to a clinic to get PrEP? That doesn't make any sense. And nowadays, with home sampling, we can do STI tests from home. People can do their sampling, send it on, and so there are all kinds of ways to get around it. Anyway, I think that the STIs after the first year are getting down, but it's a general problem when we talk about STIs, and not only for people who are using PrEP.
Can I ask, there's a question, more questions on the chat about methods of getting results by WhatsApp and emails and the safety of those. You've obviously looked into this in detail.
Well, our idea is to, we are working on the creation of an app so that would work like any app which you use for a bank or for your other health issues. So that's pretty secure. The email and WhatsApps are mostly used to contact people. So if there's a positive result, people are contacted to come back to the clinic to get treatment. It's not that much used to communicate results.
And now, Teymur, something different. We're about to get into the era of injectable PrEP when it gets licensed and into Europe. So ECDC, how do you adapt to that when something new completely comes in? It's very different. The data, I suppose, the data collection, because these will be given every couple of months.
Yeah, so that's a really important question. We haven't or thought about that currently how to monitor that going forward. We have a new monitoring system that kicks into place in February next year, which is a new data collection round, where we will continue asking these questions around PrEP, but nothing on injectable drugs. We're still so far behind in Europe, I would say, with just making PrEP available in any form whatsoever. So we're still trying to see what the key priority for us now is to see what the scale up of PrEP is in countries, if that's continuing. We've seen it from very low levels, but you saw the data that is happening in 2018, 2019. Another key priority for us going forward is all these other groups. We've talked a lot about MSM here, but for people who inject drugs, especially migrants, are not having access to PrEP, and that's something that we're going to put more efforts to. But any ideas and suggestions on how we could monitor injectables, etc., I would be very open to hear that, because now is the time to come up with those indicators.
Thanks. Yeah, I mean, we haven't had time to talk about groups outside of MSM much, but it's when I saw the gaps that you showed, it's quite incredible. And the last just quick comment, Michael, injectables, are people already coming in saying, when's the injectable ready for PrEP?
No, not yet, but they will be soon coming. I think we should welcome new options. I think that every person would has his own needs, and probably has to look for the way that prevention methods will be incorporated in his or her strategy. So they are every new option will be very welcome.
Well, look, thank you very much, both of you, for two great talks. I really enjoyed it, and I always learn a lot from this. I learned a lot today, and I'd like to both wish you both a very nice afternoon and weekend, and thank you again.
Thank you so much.
Okay, so that's the closure, actually, of this program. And I'd like to thank all of the people that put effort into this, all the speakers here. Thank you so much indeed. And I also would like to include everyone from Virology Education who have been in the back room getting it all organized. We had great support from ViiV, Healthcare, and we've also had a lot of endorsements to help advertise the program through these organizations. So that's absolutely fantastic. If you want to get some materials, they'll be posted shortly, the slide materials, etc., on www.academicmedicaleducation.com, and so please visit that. There is also a meeting survey that will be sent to you by email shortly after the meeting, and you'll then be able to get a certificate of attendance once you've done the survey. And this program has been accredited by the EU for credits. So please also connect with us on social media. I'm not quite sure what all of these mean: Instagram and Twitter and Facebook and something else, but never mind, LinkedIn. And so please do that. And there will be nurses and pharmacists, this virtual meeting really for you nurses and pharmacists has been fantastic. I hope you've enjoyed this 2020 session of this. And I really would like to thank you all for listening in and for some fantastic questions. And with that, I'd like to say goodbye.